Okay. Hello, everyone. Welcome, and thank you so much for attending our very first session of CANE's new Sustainability webinar series. My name is Ashley, and I'm joining you today from the unceded traditional territories of the Musqueam, Squamish, Tsleil-Waututh, and Coquitlam peoples, atop Burnaby Mountain. So I'm located in Burnaby, British Columbia. We would like to start in a good way and acknowledge that all of us who work and live on Turtle Island are on the traditional territories of the many First Nations, Métis, and Inuit peoples who inhabit and continue to care for these lands. We honor their rich cultural heritage, traditions, and stewardship of this land. We recognize the enduring connection that Indigenous peoples have to this land, and we commit to fostering respectful and positive relationships, not only with one another, but also with the land itself. We make this acknowledgement with the recognition that nurses have a responsibility to learn the devastating impact that colonization has had on Indigenous peoples past and present, and we recognize our duty to respond to the calls to action of the Truth and Reconciliation Commission of Canada. Next slide, Mona, please. So on behalf of the Canadian Association of Nurses for the Environment, we would like to welcome you to our webinar series. It is entitled Evolving Healthcare, Pathways to Sustainability and Planetary Health, which is scheduled to run monthly from January to April this year, 2026. The series was created through a collaboration between the Sustainability Committee and Education Committee at CANE, and aims to convene leading experts and thought leaders to explore this critical intersection we have of healthcare, environmental sustainability, and planetary well-being. And over the next few months, the webinar series will delve into various facets of sustainable healthcare, including the environmental impact of healthcare itself, climate resilient health systems, greening medical supply chains, health equity, and policy frameworks that promote planetary health. Our goal is to foster a dynamic exchange of ideas, share best practices, and inspire actionable strategies for a healthier planet and healthier populations. Through this series, we really are striving to build a very connected community of fellow healthcare professionals, researchers, and students from around the world. So on the technology and housekeeping side of things, before we start, we will be recording this session today and posting the video on our website, on CANE's website later, for those who are unable to attend this session live. If you would like captions throughout, you can click on the captions button at the bottom of the Zoom screen. You can see it. There's also a transcript option where you can see it populating and you can see what's been said before. We would also like to ask you to please use the Q&A button at the bottom if you have any questions that you would like to ask the speakers, and we encourage you to ask questions of our wonderful speakers. Don't post questions in the chat if you can, but we encourage you to use the chat right now to let us know where you're tuning in from today. So without further ado, you can go to the next slide, Mona. Without further ado, right, our first session of the webinar series is on sustainability and tertiary care across Canada and around the globe. We're joined by some folks outside of North America. So today we're joined by three inspiring speakers who will be sharing their work in greening healthcare systems, tertiary care green teams, environmental health, and sustainability. So these three healthcare leaders are truly transforming sustainability in tertiary care and healthcare systems through decisive action, innovation, and interdisciplinary collaboration. Each speaker today will present for about 15 minutes. Today we're going to follow Dr. Sargent's talk up immediately with some questions for him, and then we'll move on to our other two speakers and have a mediated panel Q&A between both Katie and Dr. Vuilleumier for about the last 10 minutes. So without further ado, I am very honored to introduce our first speaker, Dr. Myles Sargent. Dr. Sargent is a family physician with 25 years of experience working with vulnerable populations, including new immigrants, refugees, individuals experiencing homelessness and addiction, and the elderly. He's dedicated to addressing the intersection of environmental issues and health. In 2023, he became the executive director for the Canadian Coalition for Green Healthcare. Dr. Sargent also serves as co-lead of Peach Health Ontario, co-founder of Trees for Hamilton, and was the founding medical director of the Shelter Health Network in 2005. He also holds the position of assistant clinical professor at McMaster University. He collaborates with healthcare professionals and institutions to implement sustainable healthcare solutions and has launched national committees focused on sustainable procurement, food systems, and prescribing practices. So please take it away, Dr. Sargent.
Okay, thanks, Ashley. I'll start by saying thanks to all of you. Thanks for having me today. Thanks for attending. And I will give a little bit of a warning that I do go through slides very quickly. I understand this is an expert audience, so I hope it's not too quick, but I'll give you a bit of a warm-up on planetary health. Some of these concepts I think you probably know already. All right, so environmental sustainability in Canadian hospitals, that is our image we made at the very beginning to say, hey, what does an ideal green facility look like? And Vivian and William are here with me today. Next slide, please. So what is planetary health? Next slide. So I always say, I often present to the med students, it's difficult to present planetary health in 1 hour. There are different definitions, but essentially, planetary health is the intersection of everything you learned in nursing and all the environmental sciences. And my simple definition at the bottom, how we impact the environment and how in turn the environment impacts us. Next slide, please. If you were to Google the top 10 environmental problems or issues, you might see a list like this, pretty common list. We really do focus on global warming in our group, in part because you could argue it's the most urgent problem, but also because in red, it intersects with so many of the other top 10 issues. Next slide. Planetary health is so big, I focus, I would say, more on what I would call sustainable healthcare. Here's a World Health Organization definition: a health system that improves, maintains, or restores health while minimizing negative impacts on the environment and leveraging opportunities to restore and improve it. Next slide, please. Sorry, next slide, please. Okay, here we go. Okay, so what is the basic unit of measurement for global warming? I think people want to say temperature here, but that is the secondary measurement, or secondary. Next slide. The basic unit of measurement is a molecule of CO2. So all greenhouse gases are measured in terms of their global warming potential, and CO2 has a unit of 1. Methane is 83 times greater. That is from food waste, and desflurane gas, the anesthetic gas, 2,500 times greater. Next slide. But the interesting thing is that CO2 is so dominant, even though it's a small greenhouse gas molecule, it is 65 to 75% of all greenhouse gases because of the burning of fossil fuels. Next slide. And you can do a life cycle analysis of pretty much anything. And this is a life cycle analysis of a mask. What is the global warming potential of a mask? Only 0.02 kilograms of CO2, which doesn't seem like a big deal. Next slide, please. This is Maria, who is an artist from the Netherlands who had breast reconstruction surgery, and she asked her surgeon to keep all the waste from that one single operation. And this is why healthcare has a problem. Next slide, please. So it becomes less surprising that the CO2 footprint in Canada is 5% of all of the carbon footprint, greater than the airline industry, which is about 3.5%. This is a common number, 5% for the wealthy nations. I've got USA at 7.9, Australia at 4.2. We do produce a lot of greenhouse gas. Next slide. And as a result, we have the consequences of elevated temperatures and climate change. And these are photographs from Canada over the last 6 years of various climate disasters. Next slide. This is a graphic done by Dr. Jonathan Patz from Wisconsin. I got to say, I love this one. In the middle, you have rising temperatures and weather extremes and rising sea levels, and then radiating out from there, you have all the problems as it impacts human health. And in the two columns, I have some Canadian examples. So for impact of air pollution, in Canada, of course, we have a lot of not just pollution from cars, but pollution from fire, which impacts our lungs, whether you have healthy lungs or unhealthy lungs. And you can go around the circle here. Vector-borne diseases in Canada, most typically West Nile virus and Lyme disease, and jump down to 7 o'clock. Climate anxiety, big problem. And then the biggest killer in Canada, in purple there, is heat stress and cardiovascular failure. Next slide. So this came out, gosh, it's 5 years now. I remember this one kind of blew my mind when it came out, the carbon footprint of the healthcare system in England. And this would be combining ambulances and long-term care, dental offices, hospitals, everything all mixed in here. Transportation in green is only 10% of the footprint. Building energy at 8 o'clock there, only 10% of the footprint. And those are the big things that we talk about in society: transport and building energy. Supply chain, all the stuff we buy, 62%. Next slide. So a few years ago, we took the data from England and other places and applied it to a Canadian context. This is a 200-bed hospital, and the fruits on the tree are the initiatives you can take to decrease the footprint of your hospital. And we encourage people to take on the orange fruits, which we call the game changers. They have over 100 tons of CO2 per initiative. So you kind of look around at all those fruits. And there also is a cost scale on the left, from cost neutral in the middle to cost saving at the bottom. And so we modeled deprescribing medications. If you could deprescribe medications at your hospital by 5%, not only is it a game changer, it also saves roughly $500,000 for a hospital. Next slide. We also, the bottom line is all countries that are working on this big problem do focus on hospitals first. We were interested in how hospitals compare to long-term care and home care. And so we did this study, gosh, about 2 years ago now. On the left is Fraser Valley, BC, data from them, and on the right is data from Quebec. Essentially, hospitals are 30 kilograms of CO2 per bed per day, and long-term care in BC was only 8.7 kilograms per day, home care less than 2 kilograms per day. Next slide. So when we do talk to hospitals, it starts with leadership. Do you have a strategy? And there's all kinds of different strategies that you could have. And do you have a person who's most responsible at your hospital for improving the environmental impact? Next slide. Bless you. So we make these things into simple guidebooks for people. This is the first guidebook we made. It's a guidebook for hospital leadership, and just a bunch of check boxes here. Arguably, I think there's 22 boxes here, 22 of the most important things you can do at your facility. The point here is it's not all about building an energy top right. You need to have your food manager and your procurement supply chain person and your educator. Everyone needs to be involved in making a hospital green. Next slide. So one thing we do with leadership is actually talk about how leadership invests their money. And we can think about that on an individual level, and we can think about that on a hospital level. Sick Kids Hospital, for example, has $1.5 billion of investments. I'm not picking on sick kids here. I actually couldn't tell you what their numbers are, but for any hospital system, what are you invested in? And hopefully it's not fossil fuels. Next slide. Supply chain. This is, again, a huge one. That's the blue part of the graph I showed. We don't just talk about the 3 R's. We think the most important R is refuse. We often say, refuse the bad products. A single-use gown needs to be dug out of the ground, shipped to manufacturing, shipped to packaging, shipped to the hospital, used sometimes very briefly, and then shipped to the dump or incineration. Can we use reusable gowns? And we need to be thinking about this in everything we do. Can we move away from single use and move to the circular economy? Next slide. Thank you. And this demonstrates why supply chain is such a big deal. This is a computer. We all use computers. There are two different pathways here. In one of them, the computer starts in Chile, number one, bottom left, raw materials, shipped over to Southeast Asia, number two, then further north, and then into China, number four, and then across to Mexico, number five, and finally up to the consumer in Canada, number six. Next slide. We started a sustainable procurement working group a few years ago, educating the procurement or supply chain folks at the hospitals about how to have a bigger impact. And essentially what you need to do is part of the buying or request for proposals process needs to include environment in the competition, not just cost and quality. Next slide. Thank you. We at the coalition have a single-use plastics project. Our lead on that one is Sandra Alexander, so reach out to us if you're interested in learning about decreasing single-use plastics at your facility. Next slide. Drugs and devices is another big one. This actually falls under supply chain as well. Medications, shockingly, are 22% of that graph that I showed. The production of meds, 22% of healthcare's footprint. And there's various ways we can take that on. Next slide. But I did want to show you when I saw that a few years ago that meds were 22%, a little bit shocking. I suggested to you that you could get a life cycle analysis on just about everything except meds, because of course this is big pharma. I often joke it's like Willy Wonka's chocolate factory. Nobody gets inside, so it's hard to do a life cycle analysis. However, we did work with 3 engineers at McMaster to trace the journey of a pill. This is a clonazepam pill. Most of the production is in Asia. It is a 63,000 kilometer trip to get to a patient in Vancouver. Next slide. And a little bit further to Burnaby. So we also have a national sustainable prescribing group. So I reached out to all the big deprescribing groups in Canada, like Choosing Wisely, deprescribe.org. There are a bunch of them. We meet every 2 months. We make a project every year. We are working on meter dose inhalers this year. Meter dose inhalers, as you may know, have quite a big footprint for every inhaler, and you can switch to safe alternatives. Next slide. This is another one of our projects. June Kaminsky, likely on the call today. I don't see who's on, but she is a big part of this project. And one of the focused areas is low carbon inhalers. Next slide. We also have a decarbonization and action project, which started in the Greater Toronto Hamilton area, but is now expanding nationally. So if you're interested in any of our projects, just reach out and let us know. Next slide. Education, obviously super important, educating staff about what can be done. Next slide. And we are in the business of making guidebooks. Actually, this is one of the things that June helps us quite a lot with, and she's working on one for nursing right now. I don't know when that's going to be finished. If June's on, maybe she could put that into the chat. But we have all kinds of guidebooks if you want to check out our website and see the various things we've created. Next slide. Transportation, it used to be that biking was the big thing, but now it's virtual medicine. How can we do virtual medicine or nursing safely? Next slide. And if you're not a clinician, that this is an issue, we can think about conferences. We can think about research and education. This is a conference in England a few years ago. They looked at the North Americans who did a virtual conference at home because this was hybrid, and in home on the right in green, 10 kilograms of CO2 versus those who traveled to the conference. almost 1,800 or actually 1,900 kilograms of CO2 to travel to the conference. And of course, airplane's the big one there. Next slide. Food. This is one of the biggest solutions of all, switching to plant-rich eating and decreasing food waste. Next slide. And this shows you why food is such a big item. This is kilograms of CO2 per serving. So, of course, you have meat on the left, and then cheese. Breaks my heart to see cheese there. Fish, and then moving into the vegetables. So eat your broccoli, please. Next slide. We did do a business case on the fact that this actually saves money for a hospital doing plant-rich menus. Next slide. And natural systems, super important. Planting trees, pollinators, grasses at your facility. Next slide. We do have a program called the Canadian Healthcare Forest. All you really need to do is email us, and we will help to find someone in your province who can help you plant trees at your facility. This is a group of us at Hamilton General, I guess now almost 8 years ago. That was our first planting at the General. We plant about 15 trees there every year. Next slide. And these are some of the places we planted in Southern Ontario. Next slide. We also think about primary care, super, super important. I would argue more important than the hospital because, of course, if we have a robust primary care system, we decrease use of ER and hospital. Next slide. So this is our Green Office Toolkit. This is the table of contents. So there's a lot in there. It's a whole series of one-pagers. If you want to take a look at that, I've highlighted some of the most important areas. And one of the most important areas, next slide, is goals of care and end-of-life care and having discussions with patients and seeing what do they really want. And we can do this upstream. We can do this in our offices and establish after someone has a serious illness, what do you want at the end of life? Next slide. And I do always ask in my presentations, where do you want to be when you die? And I'm running a little late here. I would pause and have a show of hands, but I ask, do you want to die in hospital? Do you want to die in long-term care? Do you want to die at home? And when I do this in person, everyone puts their hand up for home. And I like to establish that first because this is very patient-focused. Next slide. Before you start seeing some of my slides, which appear ageist, these are all essentially resource slides, a study we did a couple of years ago. Top left is polypharmacy by age group with babies on the left and elderly on the right. So that's the green and blue slide. How many medications do you take per day? Of course, that goes up. Then we did a couple others, which was health expenditures per capita. Not surprisingly, that's the top right. That also goes up with age. It doesn't surprise anybody. Bottom left is days in hospital per year. Again, a little blip when you're a baby, then flat, and then starts to go up. But what was really interesting, bottom right, mortality rate. You would think that the days in hospital, some of this resource use is related to chronic disease, and definitely it is. But I would argue it is even more because you are getting into the final year of your life. And most of us spend 21 days of our final year in hospital, even though we don't want to be there. Next slide. This is a study done in Toronto 10 years ago. I'm almost at the end. And the blue, red, and there's a little green line in there are things like use of the cost of outpatient care, inpatient care, and meds. And then you summarize them with the black line. This is final year of life. So these are the final 360 days, obviously a retrospective study. To the far left is the cost in black when you're 360 days from death, then 270, the next pink dot. Bottom line, final 90 days, look at the costs. And again, I would suggest it's because we are in the ICU, we're getting MRIs done, we don't want to be there. Next slide. So my big point, we need to move to home care. There are 3 million ALC days per year in Canadian hospitals, so alternate level of care, where essentially a patient's being discharged by nursing, social work, medicine, discharged. no place to go, no long-term care, home isn't appropriate. That's 18% of our acute care beds in Ontario. We want to age and die at home, but most of us do die in hospital. So my argument, just putting a green lens on a problem that impacts patients, the cost of the system being backed up, there's a green lens here. This is good for the planet as well. Next slide. So environmental sustainability aligns with excellent patient care and efficient system and cost savings. Next slide. And the good news is we have, about a year ago, our organization partnered with Accreditation Canada. We've had a Green Hospital Scorecard for years, which has been done voluntarily by about 100 hospitals. This will now be a mandatory part of accreditation for 900 hospitals starting in about June. And that is it for me.
Wow, thank you so much, Myles. I
Yeah,
have
and
never
sorry
actually.
that went a little long to the others.
Yes, you're at 18 minutes, so we'll give you the grace of 3 minutes. I was going to say that we would love to shift over into a Q&A with you. We haven't had any coming up in the chat yet, but I believe that Mona has some pre-prepared. How long would you like to stay for a Q&A? It doesn't have to be long. I know you've got to run.
Well, I'm more concerned about our other speakers here today with only half an hour to go, but I could take a couple of questions.
That's very sweet. We'll keep it short then.
Yeah, then I can go. Thanks, Ashley, and thank you, Myles, for the stretch presentation. Lots of resources to keep in mind and totally relevant to nursing. We can't deny that. While listening to you about establishing all those strategies for leadership and changing current practice in healthcare system towards more sustainable, CAN-oriented practices, how can we ensure this is happening across all healthcare sectors within the healthcare system? Because I see here some segments have been involved in this, but not necessarily all entire kind of sector. So what would be
Right, fair.
strategy for that?
Well, look, great question. I do believe that environmental sustainability aligns with cost efficiency, and of course that gets people's attention. And look, I really do believe that. You saw the peach tree, as we called it, for hospitals, and although the cost neutral line was about halfway up the tree, that was a logarithmic scale, and so you can go quite a ways up the tree, and you're only getting to $10,000, right? So most of those things are below $10,000. And on top of that, some of the things that were higher up in the tree, we had a building energy engineer, or maybe not engineer, but building energy manager. Let's say it's a $100,000 salary, so it was at the $100,000 range, way up there. But there's a return of investment of less than 1 year if you get an energy manager at a big facility like that, right? So, of course, Accreditation Canada does more than hospitals. We do partner with them. I can't give you the list of every facility that they work with, but they do work with more than hospitals, obviously. I would argue that for long-term care, there's cost benefits as well. There's a big study out of New York City showing that plant-rich meals save 59 cents per meal. So that would obviously apply to long-term care as well. So yeah, I would. I do send the message that again, environmental sustainability does align with cost, and you can start with the low fruits on the tree and save money and put it in a green piggy bank and go up to the higher ones.
Thank you, Myles. That was indeed informative. It's nice to look at it from bigger picture, but still, I appreciate that tree kind of, metaphor just to put it into practice, right? I think there was the question on top of my mind, and thank you again for joining us today. Unless you want to say, maybe for leaving, just some words of wisdom for our audience, or who's going to navigate this webinar after we post it on CANE. Any words of wisdom?
Well, words of wisdom, it's not really words of wisdom, but And I'm sorry, I'm just kind of coming in and out here, but I'm actually doing a presentation to the global health students, and I got double booked today. And I just said to the global health students, and I've got to go back to chat with them. But we're in high school and university. We believe we can change the world, and then something happens as we get older. We become cynical, and I don't know, give up a bit. But I don't know. I'm just an optimist. I still feel like we can change the world. So there are a ton of positive things to focus on. I mean, talk about supply chain and the fact that in Ontario, Doug Ford of all people has this thing called the Bobby program, which is build Ontario, buy from Ontario. Of course, that was all about money and improving the economy in Ontario. But we have good environmental standards. So when you're building in Ontario, you know what's coming out of the smokestack, you know what's going to the water, and you've decreased your transportation footprint. I could give a whole list of things. You want me to come back sometime? I've got a hope presentation with all these things which line up in terms of, for me, serendipity. There's a lot of things that improve the planet. There's a lot of good things going on out there, but we just sort of see the CNN effect, which is pretty depressing. So don't give up. And thanks so much for having me today.
Thank you, Myles. We
Well heard,
appreciate
Myles.
all your expertise. Thank you.
So good to meet you. Have a great day.
Yeah. Bye.
Okay. Well, that brings us to our wonderful second speaker. Let's not waste any time. Our second speaker is Dr. Séverine Vuilleumier. She is a full professor at the University of Applied Sciences and Arts in Lausanne, Switzerland. So it is 9 p.m. for Séverine. Very much thank you for being here. Séverine develops research and teaching activities in the fields of environmental health, planetary health, and sustainability in health systems and healthcare. She has designed and led the first certified continuing education programs in environmental health and sustainability. Dr. Vuilleumier has published 42 scientific papers in international peer-reviewed journals. Her goal is to raise awareness of the critical importance of the environment for human health and of the key role health professionals play in achieving greater sustainability within health systems. Dr. Vuilleumier, the floor is yours.
Thank you very much for the very nice introduction. Can you hear me well? Okay, I will share my slide now. Okay, can you see my slide? Excellent. So it's a great pleasure for me to be here, to have the opportunity to present some of my interest for research, teaching. And today we're going to talk about evidence-based health promotion strategy for achieving planetary health. First, I will go through a few things that have already been said by the first speaker. I cannot change the slide. Wait, yeah. It has been said. So health system is contributed quite a lot to the carbon footprint worldwide, 4 to 5% larger than the transport by plane. And if we think about a country, it's 6 to 10%. So it's quite a lot, and we have some responsibility faced to that. And I will try it. Oh, okay. If we look at this carbon footprint of the healthcare system, we may be interested in the 4 largest to see where we can act. And I will show you some results from a very clever, large project that's been done in France. And what they show is that, as said for the NHS in the previous presentation, is that most of the carbon footprints come from medicine, pharmaceutical components, and then medical device, food, and transport. And waste, for example, is less than 5%. So that's the big one in the carbon footprint. Unfortunately, carbon footprint is not the only things that is an issue in the health system if you think about environments. And we also produce quite a lot of pollution, and we unfortunately contribute to the biodiversity crisis. And I will not go into detail about all this, but I will share some aspect of that before going to something more positive. This is one of our beautiful lakes in Switzerland. This is Geneva Lake. And one of my friends who is working at the University of Lausanne, she's an ecotoxicologue, and she looked at the water in this lake and tried to detect some pharmaceutical component. And in the water, she found more than 60 tons of medicine estimated. And this is only the water. So it's not sediment, and it's an estimation. You can think, oh, you know, those Swiss guys consume too much medicine, or they misbehave and they throw the medicine in the lake, or maybe they are crazy people. But unfortunately, it's not the case. It's a worldwide issue. There's this recent study looking at more than 1,000 samples worldwide, many countries, looking at rivers and not lakes in this case, and they found quite a lot of pharmaceutical component everywhere. I've displayed here some of the detection frequency in the sample, which components, so you can quickly look at them, you know them. If you look at the publication, it's quite worrying what we can find everywhere in our environment. So we must do something about it. What can we do? I think the first things we need to do is not to be sick. I think it's the very basic thing. So it's the best things to do to be sustainable in the health system. It's to be healthy. And that's why I would like to present you some health promotion strategy that achieve health, sustainability in health system, and planetary health. Of course, with the time I have, I cannot cover all the strategy, but maybe four, it's a start. So let's say you want to reduce cancer, CVD, mortality, diabetes. How can you do it? And how can you achieve those number reduction? I will give you the answer. Healthy diets. And it's even healthy diet within planetary boundaries. I don't know if you're aware of this recommendation that have been published in 2019. So Lancet put together a commission, which is called EAT Commission. And the task they had is to try to find diets that feed the world within planetary boundaries, and that is healthy, that the component is healthy, okay? And that was big things when they published that. And of course, researchers said, okay, it's good for the planet, it's good for the health, but what about the disease? And we're lucky because worldwide we have quite a lot of cohorts in which we know what people eat and the health status of those people. And basically, you can look at those cohorts and see, okay, we have those recommendations, and let's look at people that are really close to those recommendations and the one who are really far from those recommendations, and looked at what happened with their health. And that's exactly what people have done. And those numbers that are displayed here, it correspond to results of those studies. And I'm really happy to show that one of the studies, mine, with my colleague, and we show that in a Swiss cohort that we can reduce by 30% the mortality if we adopt these diets. And also with some students, it's always done with students. So I'm also happy with that. It's not only researcher. We try to involve the master student in the project. We collected all the information about the benefit for the health and against the disease of this healthy diet. Unfortunately, we are quite far from the recommendation. That is a simple display of the recommendation and where the gap we have. In orange, we have the recommendation, and in what is I cannot find the name in English. What is above the limit of the orange is something we need to reduce. I've displayed the initial recommendation, but last year there are more recommendations that integrate also just food system. And I think it's something also to add maybe in the equation, but in this case, it was not added. It's just a new thing. So I also added the QR code. It said that in English, if you want to have directly the report. Okay, so what is the issue? So to be honest, when I think about wildlife on Earth, I see zebra running in a field in a big reserve, but zebra, whales, elephants, all wildlife is just 4% of mammals. And the rest is human and livestock, and it's massive. And this is causing biodiversity crisis. This is causing water pollution. This is at the origin of many problems. So health has an advantage of having this diet, but all the planet also. Okay, so let's go back to the strategy that are good for the health and good for the planet, and reduce the use of the health system. There cumulative evidence, scientific evidence showing that physical activity is as effective as antidepressant for mild and moderate depression. I think it's really important because we consume too much pharmaceutical components, and there are basic things we can do. It's just walking, and it helps. And there are many evidence for that. Of course, there are some conditions and so on, but still, it's simple and it's healthy. Walking is one step, but sorry, I don't know about you, but myself, when I go to the forest, at the end of the walk in the forest, I feel very well. And to be honest, at some point, it's something I need every week. And I was wondering if it's something that has a scientific basis, or it's just me that I like to be, and it's just a quiet time and do some activities, and then I feel good. So I decided to ask some students to look at the literature to see if there's scientific evidence that walking in the forest is something good for the health, but if there's some biological explanation behind that. And we found quite a lot of evidence and amazing literature about that. So basically, anxiety, depression, blood pressure, cardiovascular disease are significantly reduced through the contact of nature. There are many meta-analyses that collect all those information of scientists who have measured everything when people go to the forest, and there are many evidence for that. So I think it's really simple, and we should refocus on those things. And also, that is something more worrying, is that it seems that the allergies that are increasing in our society, especially in cities and in urban area, that it seems that they are associated with the loss of biodiversity. Basically, exposition to biodiversity is training our immune system, and it's making the immune system very active. And when the immune system is not sorry for my English, is not solicited, it's not active, then we end up having allergy, autoimmune disease, and things like that. And those are really well explained mechanisms now. And I really like the first study who is presented here. It's by Ilka Ensky. Ilka Ensky is a well-known ecologist. So basically, he's really an ecologist who has done a lot of field work, counting butterflies, trees, and things like that. And he has a map of all the biodiversity in Finland. And at some point, he decided to make the match between his map, biodiversity, and allergy. And they found that there's a strong correlation. In area where the biodiversity is high, they're very low prevalence of allergy, and the opposite in other places. And I think it's a really nice study, and another accumulated evidence about that. Okay, so at the end, I think we need to refocus on what is health. And if we looked at the health determinant, what make me in health is first my genetics, my behavior, if I do sport, I eat well, and so on, the environment in which I'm living, if it's polluted or not, and things like that, the socio-economic condition in which I am, and also the medical health care. But if you look at the percentage, it's 11.4% estimated in Switzerland, which is really a small amount of what is health. We cannot do much about genetics, but we can do a lot with all the rest. And unfortunately, this is number for Switzerland. So we invest all the money in health for this small section, which is 11.4%. All the money goes there. And like, for example, in Switzerland, we have prevention is get only 2.7% of the financial resources. It's nothing. And in this percentage, there the vaccine, which cover almost 90% of that. So we are not investing in health. And I think it's a big step we need to do. So we have to turn from the individual health, then we move to public health, global health, One Health, and we need to shift to planetary health and think again, what is my health? How can I be healthy depending on what I drink, what I eat, and how I behave? And therefore, I will reduce the impact of the health system in general. And I have to promote some of my education. So there are extended number of continuing education, or the typo, sorry. I think it's something we should promote in the sense that there's room for improvement, and there's also room for professional health professional that want to change things, to innovate, and to invest into those new things like green prescription. I think there's many things we can do in this direction. And so not to be sick, prevention and promotion maybe is the most effective strategy to achieve sustainable health care system, and this directly achieve planetary health. That's somehow my conclusion. Thank you.
Thank you so much. Can I say merci, Dr. Vuilleumier, my limited French. It is so lovely to hear a perspective that we don't often hear in North America from our comrades across the way. I'm going to introduce our next speaker, but we will return, and hopefully we will have time for a short Q&A. We'll hear more.
Okay.
So let us move on to our third speaker. Final speaker is Katie North. Katie is a registered nurse based in Winnipeg, Manitoba. She worked for nearly a decade in a variety of clinical roles, including frontline care and as a clinical resource nurse. She completed her Master of Nursing at Athabasca, and she is currently enrolled in the PhD nursing program with the University of Saskatchewan. And is completing an environmentally focused research project aimed at large-scale healthcare systems and cultural change. She also serves on a number of environmentally focused committees, including the Sustainability Development Committee for USB, which is the Université de Saint-Boniface, and the Sustainability Committee Director of CANE. Today, Katie will be talking about her work around tertiary care green teams. So please take it away, Katie.
Great. Are you able to see my slides without my notes?
No, all we see is your list of items in your folders.
That's like your desktop. Oh.
One second. Oh, we had figured this out earlier.
Katie, maybe
where
just
we ran it.
Yeah, you can run maybe your full PowerPoint slides. Yeah, that's okay. Looks great. Yeah.
Still good? Okay, great. Well, thank you for the introduction, Ashley. My name is Katie North. I'm a registered nurse and a doctoral candidate, and I'm based out of Winnipeg, Manitoba in Canada. I'm also the Sustainability Director for CANE, so I'm very pleased to be joining you today as the presenter for our first webinar. So today I'll be discussing environmental sustainability in tertiary care. And I want to specifically highlight for all of you what sustainability looks like in tertiary care in Canada and its relevance to nursing in particular, as that is my professional background. I'm going to highlight some barriers that exist in terms of implementation of green practices within tertiary care sites and some research that exists related to this topic. And I'll also very briefly mention my own doctoral research, which is on this same theme. Firstly, as a brief overview, I won't go into too many details as we've seen from our other presenters today, and I'm sure most of you are well versed in the climate crisis already. But just as a recap, there is substantial literature regarding the emergence of a global climate emergency. And this climate change is caused by human activities. And those activities are related to our consumption of resources, the creation of natural gas emissions, and waste production. The literature also very clearly demonstrates that there's a correlation between planetary health and human health outcomes. So considering that worse off the planet becomes, the more we as humans will experience negative health consequences, this is a topic of interest for the healthcare sector. Healthcare also has a very unique relationship with the climate crisis. And this is in part due to the fact that the healthcare system will inevitably bear the burden of caring for those who are adversely impacted by climate-related illnesses. Right? Climate-related illnesses, as well as we are a contributor as a system. So healthcare is contributing to the worsening of the planetary and global climate crisis. And this is through resource consumption and waste production from the health industry. Sorry. Thanks to some prevailing climate data and more discourse that is occurring on the topic of sustainability in healthcare, a lot more is being done in recent years to integrate into business models, environmental advocacy, and strategic priorities reflecting planetary health. This has been seen in business and public and private sector industries as well. So this shift in objectives towards the acknowledgement of the climate crisis is slowly starting to take shape. However, most tertiary care facilities in Canada, their care policies are largely non-sustainable, and these organizations are still actively contributing to the planetary climate crisis. Transitioning to sustainable alternatives, like pictured here on the slide, the option of having biodegradable plastics in use within tertiary care facilities instead of traditional plastics derived from ethanol and other petrochemicals, is an option that exists, but would require organizational change initiatives to enact these product and procedural changes within healthcare. So the biggest takeaway from the literature that I would emphasize with you all is that there is a disconnect between what can be done to reduce the climate impact of the healthcare industry and what is currently being done within the Canadian healthcare landscape. And it's important with continued research that we examine why that discrepancy exists. Also important to acknowledge that there are some assumptions that exist in the area of sustainability in healthcare, and these may be either beneficial or limiting to green movements and sustainability in tertiary care. So this includes, in the field of environmental sustainability, there is some overlap with public health and economics, and some of the prevailing assumptions include there's an assumption of causality, so between environmental wellness and human health. And this assumption suggests that human health outcomes can be improved subsequently if planetary health is also improved, and that the two outcomes are linked. And this may be to the benefit of planetary and human health. Another is that there is sustainable improvements that will yield better public health results. Despite the reality being much more complex than this assumption is very much diminishing of the complexities and work that needs to go into making sustainability and sustainable changes within the system. There's also the assumption of individual responsibility for both changes to planetary wellness and the responsibility for one's own health. This assumption places the burden of responsibility on the individual to make responsible choices for their health and for the planet. Like putting an emphasis on, oops, sorry, I've lost my place. I'm sorry. So this puts the responsibility back on the person for their own health, like putting an emphasis on recycling or buying ecologically friendly products at the consumer level. And it's particularly concerning as it fails to take into consideration the influence of social governance structures for regulations and product standards, and how these large-scale decision-making systems have a much more significant impact on pollution. Also, economic assumptions exist, like discounting the cost-benefit analysis of making green changes. It affords more value for present-day economic profit over long-term future health benefits. And this is a short-sighted assumption, which often results in the prioritization of current finances over future, and can prompt maybe some philosophical discussions of how we determine value in current status versus future health outcomes. Much research, fortunately, has been done on the topic of sustainability to better understand workplace culture, perceptions, barriers to change, readiness, and prioritization for care facilities to adopt more ecologically sustainable practices. So the most common themes that are being found through these research projects and in the literature include there are barriers surrounding financial constraints in the Canadian healthcare system, preventing organizations from investing in green products and practices. And there is still a lack of data related to the long-term return on investment for these green projects, which is often cited as a barrier to get organizations to invest in green projects to begin with. Other factors, such as staff readiness and the workplace culture, are recognized as important factors that may enhance an organization's efforts for green action, or may actually be a barrier to implementing these changes. Fortunately, literature does support that nurse-led change initiatives in tertiary care are generally successful to modify workplace culture and to improve project outcomes. And therefore, nurse-led environmental initiatives could be beneficial to cause a shift in workplace culture towards sustainability, and could also be used to catalyze nurses' involvement in future sustainable governance within the Canadian healthcare system. In this vein, I am completing my own doctoral research in this area to better understand the concepts of workplace culture and its influence for green initiatives in a tertiary care facility here in Canada. And the research question that I am posing was written in a manner so that I could learn what underlying elements of workplace culture positively or negatively influence the success of a nurse-led ecological project. I'll be using institutional ethnography as my methodology in order to better understand and uncover the roots that are influencing the hierarchical governance structures within the tertiary care facility, which may hinder or allow for green initiatives to root. Nursing related to sustainability in tertiary care has many benefits. Nurses can take on the role of healthcare governance and help to shape some of these future policies for green product adoption, as well as sustainability overall within the Canadian healthcare system. Data can be used to make recommendations, organizations, which is what I hope to generate using my institutional ethnographic study for my PhD. So in conclusion, human health is linked to planetary health. It is important that we continue research on this topic, especially nursing research, to understand the hidden influences that are creating barriers to have green initiatives and green products within our healthcare systems. Organizational structure, workplace culture, and Canadian healthcare hierarchy are dynamics that need to be further examined so that we can address sustainability and a lack of action at its roots. And future sustainability projects are worth investing in. Thank you.
Thanks, Katie. Wow. I feel so honored to be here listening to these three speakers. And unfortunately, Myles had to leave, but I am really excited to spend just a little bit more time with both of you. I know that we're over time, but I'm going to give us some grace because it is our first run at this. And our participants are still here. Thank you for staying. For those who had to leave early, this recording will be made available later. And we do have some, I hope, good questions to start some really rich discussion about where we go from here. And I'm going to actually hand it over to Mona to facilitate the Q&A. So to our participants here, if you have any questions, please feel free. We'll probably try to spend about 5 minutes on this. We don't take up too much more of your afternoon. Mona, over to you.
Thank you, Ashley, and thank you, Katie and Séverine, for great presentations. I think while waiting maybe for questions from the audience, I have one question for each one of you. And I want to start with you, Séverine. As a public health nurse, you just really hit on my areas of passion. Health promotion is a big thing for me. Just saying that shift in the thinking around moving, from all the way from planetary health, but you grounded us in those basic things that we have forgotten as a human beings, and all the civilization we're living through just shifted our practices to more unsustainable practices, unfortunately. But I appreciate you taking us through your research and your program study into those really, really essential thing. My question to you is, what will it take to implement a health promotion approach to healthcare practices, whether public health or hospital settings? So what kind of strategy would it need to shift that kind of practice, whether public policy or funding? So what would it take?
For me,
Yeah,
the, the the best way would be the nurses. I truly believe that the role of nurses is critical here, in the sense that they are quite numerous, they are well trained, they have really good contact with the patient and the people, they are they are very trust, and they are really in a position to do that. And from a finance point of view, at least in Switzerland, I don't know about all the countries, but they are not subject to this challenge of making money from prescription and things like that. So I think for me, the ideal situation would be to develop a new role for the nurses and to be really promoting health through basic things like what you eat, what you drink, where you live, how you live, and maybe have some expert on that and in this promotion take this place. And I think it will be really important to take this place now, because in the future maybe there are other people who may come and take the place. From a practical point of view, like in Switzerland, we are quite a rich country, but this is not developed. It's just because of the economic aspect of it, because it's hard to get benefit from health promotion, and that's a really hard thing to solve. But I think the solution is the nurse. That's my opinion.
thank you, Séverine. And we're so fortunate to have a leader here, Katie, with us as a nurse leading in this area of sustainability, but also, really addressing important thing at system level. So thank you, Séverine, for just reminding us that investing in nurses, whom as the backbone for healthcare system, is really a crucial way to go, and just to shift all those practices into more sustainable ways. Thank you for that. Katie, I'm wondering a little bit, I got so excited about your research study, and I'm wondering if you have reached that data collection stage and if you have any preliminary kind of data to share with us, or some sort of direction to where you're heading with your research.
Yeah, so I have just completed the ethics portion, and I'll be starting my data collection next week. I have my first interviews booked. So I don't have any rough data yet to be able to share, at least not from the interview portion. With my institutional ethnography, there's also a review of all of the governance policy and procedures. So I do have all of the texts available that I've been reviewing, and I can see themes already that are emerging, like the financial barriers preventing the organization from changing products to things that are maybe a little bit more eco-friendly. But there's also external to the organization systems barriers, whereas they're not developing these products in bulk because there's no demand for them. Therefore, it's causing the costs to be higher than something that is damaging to the environment, especially when it comes to plastics that we're seeing used in the operating room and other areas of the hospital. So those are themes that I'm already recognizing and that probably are going to come into play once I do my analysis of my study. And hopefully I can generate some data that will be pertinent to the site to find a way around those barriers and make some green changes.
Wonderful, very promising future for your research study, and we can't wait till we see the results coming along. Last thing, words of wisdom from you to leave it with our audience, whom they're really passionate about the area or would love to navigate the area more. And same question to you, Séverine. Words of wisdom and just moments to leave us as we leave this gathering.
Yeah. I would like to go back to the nurse and also to recall that value of nurses when they practice. It's a holistic vision of the patient. And it has always been like that. And somehow we've lost it in a way. And I don't know why. And I think we should come back to that. And I think the value that drive those professionals, they also align with the value of the planetary health. And maybe to connect with the investigation presented, is that I know the story of a maternity where they developed quite a lot of sustainable practices, and what created is that it created value for the professional. They really liked and to do things that are sustainable, good for the patient, good for the health of the baby, good for the mother, and then it created value. And with the value, they realized that the people were not leaving the job anymore. When they wanted to attract professionals, there were many people coming and staying. So there are also other benefits for the quality of work and also for the human resources. And human resource can be a very large cost. So this is somehow we can have also benefits. Sometimes we have emerging advantage of doing sustainability. And that's all. It was not so short, sorry.
Thank you, Séverine. Investment in nurses is the way to go, of course. Appreciate that. And Katie, your words of wisdom.
Yeah, I think just for anyone who's watching, I would encourage you to network. There are so many good organizations that exist nationally in Canada and internationally that we can collaborate with in order to make our hospitals greener, make our communities greener, and to build a repertoire. Some areas are much further ahead and some are still in development, even varying from province to province within Canada in terms of where they're at with the development of nursing roles for environmental sustainability and government action towards sustainable practices in healthcare. So it's really important to connect with people outside of your réseau and your network. Now I'm switching to French, Séverine. But to just continue to connect with people and build up your community. Yeah.
Wonderful. Thank you so much, Katie. I think I'll hand it back to you, Ashley. And shall we share the contact information of our speakers?
Yes,
On the last
please.
slide? Yeah.
Yeah. And we can also post the slides along with the recording afterwards. But I really want to extend such a heartfelt thank you to you, both Séverine and Katie, and Myles, if he ends up watching this, for coming today. I really feel that overwhelmingly, what I heard from all three of you was the importance of creating connections, whether it's realizing the importance of doing interdisciplinary work across disciplines and speaking with other people in hospitals, learning how to, speak the language of money to the people who sort of have it and make these persuasive choices, finding a way to reconnect with our own health and connecting to nature and finding our way back. So from this, I'm going to take away the importance of building community and connecting with other people. And that's a really powerful and hopeful message. So I feel really rejuvenated after this. Thank you to our participants who have stayed with us for your patience and your passion. So I will just end by saying that we hope to see you at the next session. And it is tentatively planned for February 26th. Please be well in all that you're going to do for the rest of your day and the rest of your week until we see you again. And remember that we are none of us alone as we pursue sustainable and equitable healthcare for everyone on our blue-green planet. So with that, we'll say goodbye. Have a great evening. Have a good sleep, Séverine. Have a good night, everyone. And we'll see you next time. Goodbye.
Thank
Thank
you.
you.
Thank you.